Mobile dental clinics have become an innovative solution to provide dental care in underserved communities, reaching individuals who may have limited access to traditional dental facilities. While these clinics offer several benefits, they also come with certain limitations. Let's delve into the advantages and disadvantages of mobile dental clinics. Let us look at the advantages first. These mobile dental clinics have a moderate startup cost and addresses one of the most important problems stated by the underserved communities, which is the problem of transportation to the clinics. Here, the clinics go to the people instead of them having to come to the clinics. These mobile clinics also help in decreased cases of missed appointments as they run in conjunction with schools. Additionally, services are made available at multiple sites, especially to the needy population. Coming to the disadvantages, the maintenance cost of mobile dental clinics is extremely high. It has also been noted that there is difficulty in accessing and storing patient records. These mobile dental clinics, although made available at multiple sites, only provide limited services and follow-up in cases treated here may be difficult. Now, since vans are used to act as mobile dental clinics, these require permission for site use and are also difficult to navigate and use during the monsoons. Now that we have a good amount of information about mobile dental clinics and their advantages and disadvantages, there are several popular mobile dental clinics whose names and routes are important from an exam point of view. The first such clinic is Across the Smiles, which is run by the Generation Family Health Center in Connecticut. It is used mostly to deliver care through school districts in the rural northeastern part of the state and is 40 feet long. The second one is called Smile to Go by the Hospital of St. Raphael in Connecticut. It is 65 feet long, including a dental laboratory, and is mainly associated with the New Haven inner city school system. Molar Express is a 30 feet mobile dental clinic run by the Hartford City Public School, Connecticut, which provides dental services to the children of 17 schools. Lastly, there is the Miles for Smiles mobile dental clinic. It provides comprehensive dental services and school-based dental education to children and families residing in the Western Slope region of Colorado. In conclusion, mobile dental clinics have proven to be a valuable resource in public health dentistry, offering increased accessibility to underserved communities and promoting oral health awareness. The advantages of these clinics include improved accessibility, cost effectiveness, and community engagement. However, it is crucial to acknowledge the limitations, including the restricted scope of services, limited follow-up care, and infrastructure challenges. Mobile dental clinics should be seen as a complementary component of the overall dental care system, working in collaboration with traditional dental practices to ensure comprehensive oral health services for all individuals. By understanding both the advantages and disadvantages, we can make informed decisions about the implementation and utilization of mobile dental clinics to maximize their impact on public health. This brings us to the end of this video. Thank you so much for watching. Don't forget to like the video and subscribe to our channel.